Hi everyone, my name is DrMojca. I'm the director of the simulation laboratory, and I will introduce you to the environment where you will be obtaining your learning experience. What we're trying to do here is recreate the full operating room environment with all the components of a room that is served for surgical procedures. So I will slowly walk you through the things that you need to pay special attention to. If you look at this table here, this is the surgically sterile table that contains sterile instruments. And this is a space that you should not touch due to the sterility issues. So a few things, a few tricks that you might want to learn are, when you walk around the table, you want to hold your hands in front and look towards the table as you move around it. You'd never want to walk around it like this because you're not sure what's happening in the back. You don't want to walk in between it either because you may end up touching the table and desterilizing the surgical instruments. So we're going to move forward towards the anesthesia part of the operating room. In the back here, that's our cart. It contains all the equipment that one needs for the anesthetic. It contains breathing tubes, oxygen delivery systems, syringes, NG tubes. On top, we will usually have our medications, the medication box from the pharmacy, the drawn-up medications. Some of them used to induce anesthesia, some of them used as rescue drugs that might come handy when things are not going well. When we move forward, this device over here is called anesthesia machine. The function of anesthesia machine is twofold. One, it's basically a monitor. As you can see over here, all the vital signs of the patient will get displayed on the monitor. The blood pressure cuff, EKG, saturation probe are all connected to this machine and display the vital signs. The second function of this machine is delivery of anesthetic gases and mechanical ventilation of the patient. As you can see over here, this is our anesthetic gas in here, and this will get delivered through the ventilator of the anesthetic machine, through the breathing system to the patient. And then, of course, we have the patient. In this case, we're working with the 3G SimMan high fidelity simulator. This is a simulator that performs many of the vital functions. It breathes, it blinks, it has pupillary reflexes. You can hear heart sounds, lung sounds, bowel sounds. You can introduce invasive lines such as central line, atrial line. You can introduce Foley catheter, the urinary catheter. You can introduce chest tubes. So it mimics a lot of functions of a living patient, and you are able to practice different skills on it. Between the two, we're also able to recreate the critical incidents, life-threatening events. So with students, we can practice things like hyperkalemia. We can practice anaphylaxis. Basically anything you can think of, we can potentially create scenario and make it happen in this environment for you to practice on. Then as we move forward, we always will have some IV system. This is an IV pole with an IV bag and a tubing connected to an intravenous line. And then that basically creates a full patient for us, full OR environment, and you should be pretty comfortable coming into a real operating room and start working in it.